So I think the proof is in the pudding, and so what I want to show you here is the results of some actual data that I have. Being one of the first 6 surgeons to use miCOR, after I got through about 250 cases, we began a prospective clinical trial where we tried to compare phaco to miCOR head to head, and this is just some of the data that came from my site. So first thing I want to show, as I've already said, miCOR uses about half the amount of fluid per case compared to phaco. You might say, well, what's the big deal? That doesn't really matter to the patient. But to me, another thing that does matter is how quickly it can remove the nucleus. And miCOR cases are averaging 45 to 60 seconds faster than my phaco cases are. And perhaps most impressively, and I really know I know it's hard to believe, and I didn't really believe it till I saw the data, is that my post-op day 1 visions are better. So these are post-op day 1 best corrected visual acuities, which means we're refracting on day 1. And so this is the vision through the cornea or the cloudy cornea or whatever it is, right? So this to me means this is objective data that says there must be less central corneal edema with miCOR than there is phaco. That's the only valid conclusion I can come to when I look at data like this. So next, I want to show you 2 videos. Where the first video demonstrates the miCOR's efficiency and then also some of the differences between the technique with miCOR and phaco. miCOR doesn't sculpt. It's not ideal for trenching because it always has high vacuum. And so it's really meant for pure choppers. And so you see here, I had to adapt my technique a little bit and become a pure chopper. You'll see I don't impale the piece. I'm just sort of resting the miCOR tip against the nucleus as counter traction and then driving my chopper through the piece to get quadrants. So again, a pure chop technique. The second is with phaco, I used to grab the anterior cortical material and then bring the piece up and then kind of carousel the piece on the end of my phaco needle. With miCOR, I grab the center of each quadrant and bore into it and then kind of use my second instrument to facilitate collapsing the piece into the miCOR handpiece. So again, I used to work from the outside in with phaco. Here, I tend to work from the middle out because of the high vacuum that the device has. And you can see that, nucleus fragmentation there was probably, I don't know, under a minute. Now with IA, the IA technique is also a little different. We're all taught and used to going in, grabbing anterior cortex, pulling to the center, and then aspirating. Here you'll see, especially as I go sub-I, I actually just kind of aim for the equator and sweep, and it all just comes. So I'm not really specifically reaching for anterior cortex. I'm just sweeping across the equator, and the cortex just comes really easy. So that's a demonstration of the efficiency of miCOR.